For our health news, and the recent surge in COVID cases continues to climb. Patients requiring hospitalization over the past several weeks, up over 30% in our country, 70% here in Texas. So joining us now to explain the new spread of this coronavirus is our medical expert, Dr. David Winter from Baylor Scott & White Health. So Dr. Winter, first of all, when we see these kind of numbers, what's going on?
Well, a couple months ago, it was far and few between, very few cases of COVID, but it's come up big time now. You talked about hospitalization. Actually, most folks still have mild cases, thank goodness. Cough, sore throat, muscle aches, 3 to 4 or 5 days, and they're well. So a lot of COVID out there, most of it mild, except for some folks that are more vulnerable.
Well, the mild thing is what we want to hear, but of course we're coming out of the summer, we're heading into flu season as well. Is this a new variant that is causing a spike here that maybe people haven't built up some of the immunities to?
Yeah, it's hard to know for sure, because right now the testing kits just say you have COVID. They don't say if you have this variant or that variant. In fact, we know there are 2 new variants out there, Iris and then Parola, nicknames they have for those. Those are the ones that are spreading the most, but right now we don't know what they are. The good thing is all the variants are pretty mild right now. Unless you have some kind of underlying disease, you take some medicines that lower your immune system, kidney, liver, heart disease, any of those things can make you more vulnerable. You need to be very careful with crowds right now. That's the way this thing spreads.
But when you say that we're seeing more mild cases, is that a function of these variants maybe being less dangerous as some of the ones we've dealt with, or is that you've got a lot of folks that are vaccinated, a lot of folks have been building up immunity? Do you know why we may not be seeing as much severity as before?
We think it's both. We know the fact that a lot of folks have been vaccinated or had COVID. Now, if you've had COVID 6 months ago, your immunity is starting to wane. If you've had a vaccine 12 months ago, you're still pretty good until that 12-month period. Then it starts to wane also. So if you hadn't had a COVID shot, you might consider that. We got some new ones coming out, actually, Mark.
Well, I want to get to those in just a minute, but let's say you are somebody who gets sick, you're diagnosed with one of these new strains. What does treatment look like right now?
You know, years ago, we had those monoclonal antibodies. You had to go to the hospital, get a 4 or 5 hour infusion, wait there for an hour, make sure you didn't have any side effects. Those worked very well then. They don't work on these new variants, but the Paxlovid, some people call it Paxlovid, those pills work very well. 3 pills twice a day, 5 days. Most folks after that, they feel well.
Okay, so that's treatment for folks who get diagnosed, but you want to avoid getting sick if at all possible. And so we have talked about over the course of this pandemic, the fact that maybe we're going to be looking at annual vaccines. And so for folks who have not had a vaccination in a while, it might be time for a new one.
Yeah, I think it's going to be like influenza. Every year we have to get a new flu shot. Every year influenza changes. They change the vaccine to take care of that. I think it's going to be the same with COVID. So we got a new COVID shot coming up. I'm encouraging folks to consider getting that.
And should you pair that with your flu shot?
If you can get them on the same day. You know, people say, can you get a couple of vaccines at the same time? Well, if you've been in the military, you get 10 shots in one day. Yes, you can. You might want to wait a week in between so their arm isn't double sore. I get that, but you can get them at the same time. They were thinking about having both in the same shot, but I haven't seen anything about that. So I think you're going to have to get separate shots.
Now, who should be paying most attention to this?
Yeah, if you're taking any drugs that suppress your immune system, so talk to your doctor if you're not sure about that. Some skin rash drugs do that. A lot of people getting chemotherapy, they're in trouble. If you're older, if you're frail, if your kidneys, liver, thyroid, they don't work very well, you ought to consider this. The other folks, it's still a good idea. You know, you may be healthy, you may do fine with COVID, but you may have older folks that are in your house, grandparents, people that are taking those immunosuppressive drugs. You can spread it to them with disastrous consequences.
And maybe a good time to remember to take some of those just precautions that we did before, washing your hands and staying away from folks that are sick. But as always, great advice. Dr. David Winter, thank you for your time today.
Good to be with you.